Can I start?
Whenever you're ready.
Yes, I'm ready.
Okay. Hello, doctor.
Coming. Good morning, Mr.
Good
Smith.
morning. Yes, I'm here for my daughter, Jessica.
Oh, yeah.
Yeah, she's, some tummy pains for a few weeks, and it just doesn't go away. And it's not bad pain, it's not severe pain, but it's just there. So I thought
Okay.
maybe you could have a look at her, please.
Yes, yes. First of thing, I need to ask some more questions. When
Sure.
did it? Did it start? It started.
When
When
did it
did it
start?
start?
When did it start? It started about, I think it's about 3 weeks now, maybe more, 4 probably.
And you said that go away and back, not
Uh,
persistence.
well, it doesn't go away. It's there, but it's not bad, severe pain, but it is there. Uh,
And do
so
you find where exactly the pain is located in the
uh,
abdomen or general?
the tummy, it's no, it's the right side of the tummy, more to the flank, I think.
Okay, and how bad is it from zero to seven?
It's from 0 to 10. How much is it, Jessica? 6. Okay, yeah, maybe 5, 6 sometimes. Yeah.
And is there anything make it worse or better?
No, not really. It's the same.
Or is there any other symptoms with this pain, for example, nausea, vomiting, or
Mm.
such?
No, no, she's been fine. Otherwise, it's just the pain.
Okay, let me see. I can remember everything you said that your daughter Jessica has abdominal pain for a couple of weeks, and
Four
is
weeks.
it
Yeah,
4 weeks? Is it
yeah,
correct?
yes.
And the severity of is maybe around 6, and there is no any sign or symptoms along with this. Is it correct?
That's right, exactly.
Is okay. Um, After examination, as your information, you said that, and I examined. In examination, I found a mass in her flank, and for this reason, I think that is better. You would do a sonography for find out what is the reasons for her symptoms and the mass I found in examination. How do you feel about this?
Well, is dangerous or?
Uh, I'm not sure, but after doing sonography, we can find that what's the reason for this. Do you know, or do you know what sort of things the sonography maybe would show to us?
No, no idea. Uh,
Uh, yes, I explained to you sometimes. Sometimes maybe the infection or inflammation can be with these sign or symptoms, and sometimes serious underlying causes for these symptoms.
Okay, I stop you here. Okay. No, you don't talk about anything serious at the moment, okay? We don't want to cause unnecessary anxiety, okay?
Okay.
Now, okay, so that's the first part of the consultation. So we usually say, okay, there is, we don't use the word mass, okay? We say, well, there's a fullness I can feel here, and I don't
Mhm.
know what it is, okay? And I'm not sure what it is. I think we need to do a urine test and maybe an ultrasound examination, if that's okay.
Okay.
And if they say no, then you have to explain why. we don't usually say anything serious at this time. We just say, well, because I don't know what it is. I asked, is it serious? You say, I don't know, I'm not sure. But you said, well, I wouldn't know. I can't say anything now because I don't know what it is. But we have to basically do this to see what it is. Okay, this.
Okay.
Big, so there's a fullness which doesn't usually happen, or which isn't shouldn't usually be there. So I don't know what it is. Okay.
Yes, yes.
Okay. Now, now we go to the second part. Now you're back the next day, and okay,
Okay.
okay, I'm back the
Uh,
next day. Okay.
okay. Come in.
Okay. Hello, doctor.
Hello, good morning.
Good morning.
Nice to see you again. And
Thank you. Uh,
you are here regarding your daughter's test result, aren't you?
yes, it's Jessica's. Jessica's ultrasound results. Yes.
Yes. As you know that after examination yesterday, we found that a fullness on her on her flank, and for this reason, and you mentioned that for 4 weeks she had a abdominal pain, and for this reason, we wanted to do a sonography. Is it correct?
That's right. Yes.
And unfortunately, the results were not as we hoped.
No, no,
And
no, 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 no. This is not breaking bad news. This. How do we do that? We're going to break bad news.
yes,
Uh,
now
so
I'm before that, I said that okay, I have the test result now here, and would you like to show you and explain about you?
oh, yes, please. That's why I'm here. Yes.
Yes, and now I started for breaking bad news. Unfortunately, the result were
Uh,
not.
okay, okay, okay. Right. I thought well, when you want to break bad news, you need to tell the patient that, okay, how much would you like to know about this? And usually the patient says everything. Okay, so there's some good news and bad news. Which one would you like to hear first? Okay, there is some good news and bad news. Okay, which one would you like to hear first? Okay.
ببخشید، یعنی به مریض بگم که من هم یه خبر خوب دارم یه خبر بد، کدومشو اول بهت بگم؟
بله، بله.
و چقدر خب مثلا مریض میگه خبر خوب، خب خبر خوب رو بهش میگم که خب آخه اول باید خبر بد رو بهش بگم، به خاطر اینکه
اه،
اول باید بگم که مثلا وینز تومور داره، ولی خبر خوب اینه که این یه توموریه که خیلی راحت و ما خیلی خوب میتونیم چیز کنیم و خیلی خوب به درمان جواب میده و از اینجور داستانا.
اوکی. ببینید اکثر موارد مریضا میگن اول بد نیوز رو بهمون بگو. اوکی.
بله.
ام، تقریبا همیشه، ولی اگر هم بگن good news، اینا بعضی وقتا اگه بخوان سر به سر ما بذارن میگن what's the good news. البته تو این شرایط معمولا کسی حوصله مسخره بازی نداره، ولی حالا تو امتحانا اگه بخوان این کار بکنن میگن the good news is that the condition is treatable and is manageable, it can be controlled. Okay. So this is the good news. Now, would you like to hear the bad news? Yes, please. Okay, the bad news is that this seems to be a growth. Okay. Uh,
Okay.
so, okay, so we say, so in breaking bad news, the first thing, as you said, is spark. It's yeah, it's setting and privacy, and then asking for permission, asking if they would like somebody to come and sit with them, and if you need some to make sure that you keep good eye contact, and so the setting needs to be good. to be appropriate. And then you ask them if they would like to hear the good news and or the bad news. Okay, you say, well, we have good news and bad news. When usually when you ask the patient, would you like someone to come and sit with you and that sort of thing, people feel that there's something wrong. Okay, and usually when I say, okay, would you like anybody to come and sit with you, and they say, oh, well, doctor, it's bad news, isn't it? So they usually ask you. Anyway,
آها. یعنی
uh,
حتما اینو باید بپرسیم ازشون که دوست داری که کسی باهات باشه یا نه.
uh, yes, yeah, because someone who's having such bad news may need some support, basically.
بله.
Anyway, okay, but you sometimes say, well, it's not appropriate because that is in hospital setting that you have a choice. You say, okay, you want someone else to come and sit with you. Sometimes even a nurse or somebody can come and sit with her. But in the doctor's surgery, it's suburban medical clinics. You can't do that. So you just say, okay, come and have a sit, and but then you need to make sure that yes, as you said, we had an ultrasound scan for Jessica because she had this pain for 4 weeks. Is that right? Yes, that's right. Okay. Well, the results. Well, there is some good news and some bad news. Which one would you like me to tell you about, or which one would you like to hear first? Okay.
Okay. And the patient chose the bad news the first.
Yeah,
Right.
usually they usually say the bad news. So we go with that. Okay,
Okay.
we can practice both ways, but yeah. Okay, let's go. So start from
Right.
there. Well, there's good news and bad news.
I have bad and good news. Which one do you like to hear the first at the first?
Okay. Um, right. You can listen to this later as well. Uh, there is good news and bad news. Okay. Not I have. There is good news
There
and
is.
bad news. Which one would you like to hear first? Okay.
Okay. There
Uh,
is good news and bad news. Which one would you like to listen at the first?
to hear first. Which one
To
would you
hear.
like to hear first? Okay.
To hear first. Yeah.
Good. Okay. So what's the bad news, doctor?
Unfortunately, the result were not as we hoped and showed, I'm afraid, the fullness is due to a serious condition. And I'm so sorry to tell you, your daughter has cancer in her kidney.
I can't believe it.
I'm so sorry to tell you this news, the break news today, but the sonography confirms it.
Okay. So what? How does the ultrasound say it's cancer?
Um, the the ultrasound show us mm, is a is a mass in the cancers, and we called that the Wilms tumor. But the good news is that it's a common cancer in children, and it is very likely to be treatable and have a good prognosis. And at this situation, it's better Jessica will be referred to a surgeon for straightway assessment and surgery about after straightway. Is it
Okay.
correct?
Is it
How
okay? Right.
how do you feel?
Right. So how common is this, doctor?
It's a common disease between the childhood age, and I appreciated your concern, but it's very likely to be treatable with a good prognosis.
Okay. Right. Who does the treatment? I mean, what should we do?
Okay. I would arrange an appointment for a surgeon and refer Jessica to surgeon, and the surgeons assess and may for the Jessica situation provided a surgery for this mass, and after that the give follow-up visit for Jessica for prognosis after surgery. And this is my management plan. How do you feel about that?
Okay. Do you have any suggestion about the specialist? Is there anybody in particular we should see?
Yes, I think that it's better to. I will provide a appointment for the pediatric surgeon, and after that you go to their clinic for undergoing surgery and treatment after surgery.
Okay. Uh, okay. So this means that she definitely needs surgery.
Yes, yes.
And then would this be cured? I mean, is there any other risk?
Um, it is very likely to be treatable, but anyway, any surgery maybe have a risk. But the evidence in all of I have a few patients have this disease, and it is very likely is very likely to be treatable if you follow the instruction and the management plan.
Okay, that's good,
Is there
doctor.
anything? But we are here for help you and Jessica. If you
Okay.
have any question or any problem, please come back and to see us.
Okay, sure, doctor. Thank you.
Okay, bye.
Bye. Good. So, how did you feel?
Um, um, من الانش رو نمیدونم، ولی موقعی که داشتم چیز رو میخوندم، اون یکی رو میخوندم، میدونستم، ذهنم باز بود و میفهمیدم هرچی رو کجا باید چیز کنم. یعنی نسبت به قبلا 0 بودم و الان 10ام نسبت به این موضوع. وقتی مثلا یه سری چیز دیتاهایی راجع به بد نیوز سیو کردم، نگاه کردم، با لاجیک همه رو رد کردم و گفتم اینا خیلی بی خودم، در صورتی که قبلا اصلا اینجوری نبود. سعی کردم فقط حفظشون کنم. این به نظرم میشه که من فهمیدم، من اون پرسپشن موضوع رو فهمیدم. فقط فکر میکنم توی اجرا خب اشکالاتی دارم که مثلا اینکه I have test result and you correct that there is or
Okay.
there are. I think that, but your access is very important rather than
How do you feel? I mean,
great.
great. Okay. What score would you give yourself?
I think that 8.
8 out of 10. Okay.
Yes.
And so, what was done well? What went well? Hmm?
I know that how the structure very well for rapport, giving information gathering, giving information, and how to break news, and where I need to pause and where I need to start telling or asking questions. I think that in this uh, I'm great.
Okay. You said you don't give yourself 10. Why?
Uh, I think that after you mentioned that the structure is about the ice, I again forgot to ask about ice, and I have before starting I have one question. For ice in the Gekimedics mentioned a different questions and emphasis that you need to ask this question for finding ideal concerns and expectation in the information gathering. It is necessary to ask these questions.
Uh, not definitely. If the patient tells you, uh,
Okay,
but if the patient doesn't tell you, yes, you need to ask. You need to ask, what do you think it is, or what is it that you're concerned about, or what is it that you would like to achieve today? What do you think we could achieve today? What would you expect to achieve from today's consultation, or something like that?
okay, okay,
But when you find the ideas, concerns, expectations, you clarify that with the patient. So you set the agenda. Basically, you say, so you are here today to hear the results of the ultrasound exam. Is that right? Yes, that's right. Okay. Uh, so, I mean, at each stage, when you give the information, then patient has a new concern, which is cancer, and you say, okay, so this is you're concerned about it, and explore that. You say, why are you concerned? What do you think? How do you feel about this? Usually, because cancer is a big word, it has a lot of stigmata around it. So you explain that, well, it is a kind of cancer, but it is not the type that is very dangerous. It is actually quite manageable, and that is the good news.
okay,
We usually we tend to be careful with the wording when we break bad news. One thing is we say cancer is a C word, okay,
okay,
in consultation. Basically, we say it's a taboo, like
okay.
the F word and that sort of thing. So uh, we say try to avoid using the word cancer. Okay,
Uh-huh.
we usually say, well, it is a growth, or it is an abnormal growth. Okay,
Okay.
so the other thing is we don't usually say it is something serious. Okay,
Mhm.
um, and we don't say unfortunately. We usually just say I'm afraid.
Okay.
Okay. Yeah, you can say, well, I'm afraid it shows an abnormal growth in Jessica's kidney. Okay.
Okay.
Um, so, um, right. And then
Instead of serious, we can use which word?
there's an abnormal growth.
Okay.
Okay. You're trying to tell her that it's not serious. Okay. But you say it is serious. So we don't want to say something is serious, even if somebody has I don't know, um, uh, head of pancreas, adenocarcinoma. and we know that it is very poor prognosis. We don't say that. We just say, well, I'm afraid your results show there is a growth. Okay. Uh, and exactly after that, but the good news is that it is treatable. So when you say the bad news, make sure to give the good news very quickly. Okay. So don't wait for too long. So you say, well, yeah, I'm afraid there is a growth. There is an abnormal growth in Jessica's kidney, but the good news is that it is treatable and it is manageable. Okay.
آها. بدون پاز بینش، چون تاکید داشتش که حتما انقدر مکس کنین که مریض واکنش نشون بده، پس باید بلافاصله خبر خوب رو بگم.
یه پوز میکنید بله، ولی بلافاصله بعد از پوزش وقتی که دیدین که ممکنه نفر گریه کنه، شما نمیتونی بگی the good news. You need to give them some space, but exactly after that you start the good news. Okay. دوباره شروع نمیکنین دوباره bad news رو explain کنین. good news رو میگین، بعدش اون وقت دوباره میگین که okay, so would you like to know anything any more, or would you like me to answer any questions, or do you have any questions? Okay. So basically, in breaking bad news, what we do is we say the first thing is there is good news and bad news. Which one would you like to hear first? Okay, I'm afraid the ultrasound examination result, or the ultrasound result, shows an abnormal growth in your kidney. And then you pause, and then when they start to show something, you can show empathy. You can say, well, I understand I understand it can be very shocking, or it can be very sudden, but the good news is, okay, I understand it is it might be, I understand it might be shocking or too sudden, but the good news is that the condition is manageable. Okay. Right. And remember, treatable, manageable, and controllable. Okay. Remember that. Treatable is manageable, is controllable. Okay. Well, if something is curable, it's not bad news that much, okay? But yeah, it is anyway. You don't usually say it is curable. We say it is manageable, it's treatable, it is controllable. For example, when somebody has diabetes, or if somebody has heart failure, you cannot say that it is curable. You say it is controllable. We can control it, or we can manage it. It's manageable. Or it is treatable. Okay. And then you carry on and say, okay, would you like to, do you have any questions, or how do you feel? Would you like to know any more, or how much do you know about this? Okay. Right.
یعنی خبر خوب، خبر بد رو میدیم، بعد ازش میپرسیم که how much do you feel about this.
How do you feel, and or how much would you like to know? How much do you know about this? Or do you have any questions? Okay, so basically you give the diagnosis, and then you ask them if they have any questions. Usually they say what causes it, or that is etiology, or what treatments are available, or what the prognosis is. Okay, so you can actually give them as they ask, or you can actually tell them, would you like me to explain more? And they say yes, you just tell me. Then you use this format, yeah. What is, how it is caused, what treatment plans are available, and what would happen in future. Okay. Uh, so basically, what it is, what we are going to do, and what happens later. Uh, right. Um, okay. We don't use the word mass because mass tumor, tumor we don't want, cancer we don't want. Okay. Just say a growth. There's an
بله
abnormal growth. Okay. So we
abnormal growth.
we don't want mass cancer or growth or tumor. Uh, okay. You
And
mentioned
another,
yes.
oh yes, sorry.
Go ahead.
Another thing, in the medics mentioned that when the first patient came to see, you mentioned that ask, could you please to me what happened so far? I think that for this example, Jessica is only for yesterday till today, only 1 day. I didn't ask these questions. But for another patients, for example, the patients came here and back 3 weeks after, I need before back to results or etc. It's necessary to ask, could you please, what happens so far?
Yeah, could you remind me? Okay.
Could you
Uh,
remind?
could you remind me? Could you remind me what has been done until now? Or yeah, well, could you remind me what we have done until
Okay,
now? Okay. So yeah, that's a way of opening the conversation. Sometimes maybe yeah, it's just we call it a gambit, a starting point.
okay, I know.
Okay, so uh, y- I think if you get a case note or a role play with the new format, they will actually ask you to ask some questions, and because that is the part you need to get marks from. So the format would be definitely something that you need to do all of those. That's information gathering and exploring ice, and then giving information. So yeah, definitely the exam would be something like that. And make sure whatever the case note says, you start from the beginning. Okay.
Yes.
Um, right. Okay. So the yeah.
ساری منظور شما این بود که توی کیس نوت قید میکنه که از اول استارت بکنین یا اینکه اگرم قید نکرد من خودم از اول باید استارت کنم یعنی giving information.
دقیقاً دقیقاً
آها.
دقیقاً
همیشه من باید از اول شروع کنم. بله
بله دیگه،
متوجه.
برای اینکه اینفورمیشن گدرینگ و راپو به شما نمره میده دیگه. اونجا در واقع اینا هر کدومشون، اینفورمیشن گدرینگ و راپو، اینا هر کدومشون تقریبا 100 نمره، نه 100 نمره زیاده. چقدر بود؟ 50 تا فکر میکنم. اینا هر کدومش 40 نمره داره، 5 تا 40 تا 200 تا. اینا
پس
هر
در واقع
کدومش.
بله، پس در واقع یه مریضی که اومده حالا 2 3 هفته پیش یک کارایی ما براش کردیم، حالا برای جواب تست هرچی اومده همین جمله‌ای که شما فرمودین could you remind me what happened، این شروع کننده خوبیه که شروع کنیم
بله.
برای اینفورمیشن کردیم. بله
Okay, yeah.
ممنون.
Could you remind me what we have done, or could you remind me what has happened, what happened? Yeah, but the best thing is, could you remind me what we have done till now?
اوکی.
And then you can ask some more questions. Okay, how have you been? Did you feel any better? Did you feel any worse? Okay, so one open question and one closed question, definitely. Okay.
اوکی thank you.
Um, so. Right. So then you said prognosis. Well, we don't use the word prognosis for lay people, we say the outlook or the future, or yeah, we usually say the outlook, or even if you want to say prognosis, you should say it properly, the full word, prognosis, not prognose. Okay,
Yeah.
say that, prognosis,
Okay.
prognosis. You said okay. Let me write this. So mass, cancer, tumor. No. Okay.
Abnormal growth. Yeah.
Uh, we say abnormal growth, or there is a growth, just a growth. So we don't say prognosis. We usually say the outlook, or even if you use prognosis, say prognosis fully. At this situation, we actually say in this situation, okay? The preposition is in. You said between the childhood age
Among.
among children, okay?
Yeah.
It's one of the commonest growths among children. I will appreciate it. Well, I would appreciate. Okay. Uh, appreciated is not correct. I will make an appointment for surgeon. No, with surgeon. Okay.
Okay.
Or Jessica. Okay. For Jessica with surgeon. Okay. Uh, شما بگید من برای جراح وقت میگیرم. برای جراح اپوینتمنت میگیرم. نه. برای جسیکا with a surgeon. Okay. Um, right. So what went well was yeah, you had rapport, you had the structure, information gathering. So you could have said, yeah, could you remind me? Yeah, could you remind me what has been done so far? And then you explore any eyes or any new eyes, then you give information. In giving information, we discussed this breaking bad news. And so good news, bad news. And then we're going to discuss what could be done differently in this case. What do you think? Which part do you think you could do differently?
Uh, I think that in the giving information.
Okay. Yeah, one of them is basically this one, remind me.
Okay.
The other one is you mentioned in information giving, yes. In that you could have said, um, how do you feel, or how much would you like to know? How much would you like to know? Or do you have any questions?
یعنی از این سه تا سوال یکیش رو لازم بپرسیم یا
بله
نه
بله
یکیش رو فقط.
بله یک. Uh, so and then exactly then give the good news, right? So if the patient says, "Well, I don't know. I have no idea. I can't think," you just tell me. I don't know what it is at all. You start to say that, well, it's a growth. It's the commonest growth in children, the commonest kidney growth in children, and then the good news is that it is treatable. Okay.
Yeah.
Um, So we don't know why it happens, but it might be related to genetics, but we don't know. We're not sure. And the management plan is usually to send you to see a pediatric surgeon, and they will tell you more about the management plan.
Yeah.
And the prognosis is usually good, and it's very likely to be treated successfully. Okay. Right. So basically, you can establish what the patient knows or what they would like to know. Right. Is there anything else? And then you say, well, reassure them that you're always available. You can say, if you have any other questions, make sure if you need any help, I'm available. You can contact me. You can call back and come and see me. Right. So, um, right. Uh, Anything else I wanted to say? No, I think that's it. Right. And you show empathy, yeah? You show empathy. Did you show empathy?
No, not much.
Uh, you need to say, yeah, I understand. It might be shocking. It might be too sudden. Okay. And yeah, that is very important in breaking bad news. Definitely, you need to show a lot of empathy. Uh, so, and the other thing is, as we discussed, we don't say unfortunately. We just say, we don't say serious. Okay.
Okay,
Uh,
I'm sorry. It's okay. I'm afraid. I'm sorry.
uh, I'm afraid. Okay.
I'm afraid.
I'm afraid. Yeah, it is. Uh, okay. Right. So the action points would be that, yep, when we start, we say, remind me what has been done so far. And then in information giving, okay, you say, I'm afraid this shows an abnormal growth. And how would you feel, or how do you feel about that? And yes, you give them some space, show empathy. You say, I'm really sorry. I understand it might be shocking. It might be too sudden. Um, I'm sorry, and I understand you. But the good news is that it is treatable. Okay, but so exactly then um, you give the good news. Okay.